Hello, Thrive Nation. I've got an incredible show today. It's all about biological dentistry, holistic dentistry from two of the experts in LA. And it's a privilege and it's an honor to have them on the show. That's from Smilebody Dentistry. And it's Shawn and Ben Javid. Welcome to the show.
Thank you. Thanks for having us, Steve. We're excited.
Yeah, absolutely. Just let us tell us a little bit of what biological dentistry is, and maybe you can take a nugget and just something unique about why and how it is so important for people's health and wellness.
Well, you want to take that? Sure, sure. You'll probably give our 2 cents too, but the basics of biological dentistry is number one, we look at the whole body instead of the mouth only, and we appreciate the mouth-body connection. In fact, everything in the body is super connected in many ways that's overlooked. So the mouth-body connection is vast, not only blood vessels and nerves and even meridian channels and all these factors that we look at. And the other aspect of it is the toxic burden we look at as far as what materials we use, what treatments do we do, how we remove sources of toxicity. Relieving the toxic burden for the body to thrive is a big mainstay for us. And lastly, I would say a very important aspect of what we do is looking at root cause of problems instead of treating symptoms. So these are the 3 pillars, I would say, of biological dentistry as far as we see it and what our philosophy is and how we address people. We want to get them healthy from within, and then the teeth thrive, the whole body thrives, every system of the body thrives because it's all connected, and it's what makes your teeth be healthier, for example, or oral health. Same thing that causes systemic health. It's all connected. So nutrition is a big component. So the microbiomes, oral microbiomes, these are the main factors. Did I miss anything, Sean?
I mean, that's pretty much. I mean, usually what I say is that, after practicing for 30 years in dentistry just gets you ready to be great mechanics, and materials don't matter, right? You can put metals and root canals and different kind of materials that causes a lot of systemic issues. So biological dentistry, like Ben was talking about, considers what materials go into the mouth that's biocompatible to your body, it's not causing harm, and how do we get toxic materials out safely so it doesn't cause harm to your body. But the rest, obviously, Ben talked.
The truth is we're trying to fix how much dentistry in general as an industry has harmed people. to be honest,
Which we have ourselves.
Yeah,
we have ourselves. We did the same kind of dentistry for many years.
What we were taught in schools, in our dental schools, and unfortunately, we believe that the current system is actually causing more damage to people's health and than actually helping them. So you have to evolve and grow, which is what we're striving to do every day.
And that's why we need more dentists like you that are biological dentists. But what about big dentistry really preventing this, amazing field from growing? And there's, like you said, you get the fundamentals taught at university, but they haven't really changed the way they're practicing, haven't looked at the body holistically. It seems like a big find. I mean, I've been a physician for so long here, and then I say, look, you need to go to a biological dentist because actually, your GIT, your gastrointestinal tract starts from your mouth. This is where it starts. This is the tract. This is the tube. And I get a lot of resistance, and then I try and convince people, and then they go back to their traditional dentist, and they says, no problem, we can do root canals. I'm in a building here with 8 dentists. They're still doing root canals. Some of them have stopped with so the mercury fillings, but there's just so much resistance in big dentistry. Is this a funding perspective? Is this a university perspective? And maybe, and I know there's too many questions here, but possibly in a very short, paragraph, how do you encourage people to actually take on biological dentistry?
I mean, that's a great question. But most of the patients that are following us now, nationally for sure, people are flying to Smilebody to come and see us. We're getting the word out, and obviously we're getting international people coming in, which is we had a few people that came from Lithuania recently. So we're getting the word out, just like we talked about right now, what biological dentistry is about. and what's the natural way. And people are really, after COVID, they're really seeking, to be more healthier. They're realizing there was something wrong after COVID and they want to be healthier. So we have people that are coming in, three different kind of people calling us. There are people that don't really know what biological dentistry is at all, and they're coming in to kind of get more knowledgeable. There's some people that are very knowledgeable that come in, and some people are in the middle, right? So when they come in, we're just having a conversation with them. We're going over, like Ben said, total body health. We're having a conversation about their oral microbiome, how it affects the gut microbiome. Like you said, it's the gateway to the body. And then we take something called a chromium CT scan in the practice that we kind of evaluate the whole mouth to look for toxicity. So all these matter, but we have people coming in from all walks of life that come in.
Yeah, it's most. I would say most of our patients that walk through the door are already in line with this type of thinking, and we're not trying to convince them of it at all. So just to answer that question in a short, we don't actually try to convince people of anything. So if we're having to explain why this, extensively, why the root canal treatment is not done in our office anymore, too much. They're not really looking for this. They're looking for someone to get a cleaning and do a filling and just fill holes. And what we call it, mainstream dentistry is just to fill holes. And for us, we want someone. We're our target audience, and our target is people that are looking for whole body health. And because so much of your health, the gateway of your health is your mouth, whether it's source of toxicities we talked about, like metals. In fact, root canals, like you mentioned, something else called cavitations, which are a big factor. Sleep and airway issues, big factor in overall health. The meridian blocks. These are all things that happen more in the mouth than anywhere else. So if we're ignoring the mouth, and you're missing the boat. And this is one thing that we speak to other, practitioners like MDs and NDs like yourself, and we like to help communicate this to them, so that if they want to get better results for their patients, we have to collaborate. We have to work together. This collaboration model, we feel, is the future of healthcare, where we can work together to help our patients thrive, not necessarily just do your own thing. If a cardiologist just looks at the heart, if someone is having heart palpitations, let's say, and they just look at the heart only, again, that doesn't make sense. It's missing the boat. You have to look at the whole body. There could be other sources, so skin or anything else. The mouth has a vast effect on all that: brain fog, gut function, in many ways. So for us, that's the philosophy.
Brilliant. Let's talk about some hot topics that are still out there. I don't know how big is in the US, although I still get, emails about Mercury fillings. People are listening now. We don't want to instill fear. We want to inspire and encourage them. So apologies there. We want to inspire and encourage them to take change and to go into a biological dentist. And I know that the removal of these fillings is crucially important. But the correct way is very, very important. Tell us through your process, what they should be looking for. I think there's some traditional dentists that the person comes in and says, oh, what, I want a ceramic, or I want this, I want that. I'll just take out the mercury, which can be more detrimental. So give us your process. And if you're listening out there and you've had a root canal, please, fear is not going to help you. We want to empower you to make the right decision and to find the right practitioner that you trust. Yes, root canals, we know through the research and through documentaries, which we might get into, can cause significant disease in the body. But we don't want to get people to have fear and contract. We want you to expand and find people like, Ben and Shawn here with their clinic Smilebody.
Yeah, I'll start with this because I got sick myself, as Ben knows, in 2016. Like I said, I've been practicing for 30 years. The first half of my career, just like dentistry tells you, people will come in, I don't want this metal filling. Let's take it out. They tell us to drill on it, just like any other filling, which is not, because what we lecture about is 54% mercury in there, right? So now what people don't realize is that when you have a mercury filling in your mouth walking around, it's releasing mercury vapes all the time, right? Hot, cold, chewing, surfacing, and any kind of, rubbing on that filling is going to release mercury vapes, right? Now, there's something called EMFs, electromagnetic frequencies, that a lot of people don't realize. When they pick up the cell phone, the signal from the tower actually goes to the metals first. It's more attractive. It's like an antenna, right? So, but these are not pure metal, right? So they're not like metal implants, which has its own problems. But the mercury, it's actually the vapes get released twice as much. There's literature on that that's being released into your system, right? Now, when you go to a dentist and you want to take it out, like I did when I got sick, was when you drill on these mercury fillings, 3,000 microns per minute are released from this mercury, odorless, tasteless, right? And so when it touches the skin or hair, it gets absorbed. And where does it go? It goes into the thyroid. It resides in the thyroid, the pituitary gland, right? And then it gets into the blood. And the way that your blood wants to clean it up, your body gets absorbed into the organs, right? So now you have heavy metal toxicity. So organs are not functioning properly. So we talk about
Your brain, don't forget your brain.
everything.
Ultimately,
Everything.
heavy metal toxicity obviously has a lot, means
Yeah.
it's the reason we call it heavy metal toxicity is because it's hard to remove these toxic metals from the body after it's there, especially the brain. And as we know, mercury is such a neurotoxin. And the ancient stories of the Mad Hatter are these all related to mercury toxicity. This is not a question, but unfortunately, still here in the United States, this is not a banned material. Mercury fillings are still being placed.
Yeah.
We have it's what I like to point out. It's crazy because legally, all dentists have to have something called an amalgam separator in their office, meaning we can't let this toxic material go down the drain. Why? Because it's bad for the environment. They know it's horrible for the environment. It's number one source of toxicity as far as mercury for the environment.
But it's okay to be in your mouth.
But it's okay to be in your mouth, and it's okay for you to drill on it, and it's okay. So it's just a backwards kind of situation.
Yeah, and the process what you were mentioning, how it's supposed to be done. The way we do it at Smilebody, the patients come in, we have a special room, we drape them from head to toe. You cannot have any skin exposure. You cannot have any hair exposure. Hair is covered. Oxygen is placed. We have them gargle with charcoal to absorb some of the mercury. There's huge vacuums, mercury vacuums next to your face, and also vacuums in your mouth. So these are removed very carefully because they're very dangerous, right?
And you want to remove them with minimal drilling.
Yeah,
and
you don't want to drill them. Yeah.
Break them apart rather than drill through the whole mercury. So it needs a lot of irrigation.
Yeah, we have special doctors for that here. That we have a team of biological dentists here in the Smilebody that are specialized in different areas. So we have prosthodontists, our biological dentists that help us with the mercury removals. So we have specific standards of how it's supposed to be done, right?
To protect the team and the patient.
Yeah. Yeah, and then once that's done and it's nice and clean, then we use biocompatible materials. We have a laboratory on site, so we fabricate like porcelain fillings, or if you want to put composites. People don't realize even composites are toxic. They have a lot of microplastics, so we have to use BPA-free composites, right? So depending on what we're using, depending on how large the restoration is, then we pick what kind of biocompatible material we're going to use.
Brilliant. Now, and I think this is important. I think one of you can answer this. Someone's listening now and they want to get rid of these mercury fillings. They need to, is there something on your website, or do you have a reel, or maybe you can just give me 7 points that they can ask the office to say, do you have a vacuum? Is there oxygen? Is there this? So 7 points. So someone's listening saying, okay, this is what they're going to ask.
Well, you know what? One easy thing to do, and one of the entry levels into this world of holistic, biological, functional dentistry is getting certified in this process, safe removal process, called SMART. SMART, the IAOMT is one of the governing bodies of holistic dentistry academies that certifies. There's a different certification with IABDM, but IOMT is probably the most well known. Where their certification process is called SMART technique. So, I would just, number one, ask, are you certified in the safe removal process? Because if they're not certified, then they might just say they are, or oh, I use a rubber dam only. That's not enough. To remove to do it correctly. So I would ask literally if the center is certified in this.
Okay.
Yeah, we've actually taken this to the next level. We had a meeting a couple of weeks ago in Venice, California, with some international doctors that came in, and one of them was actually from Australia. And so we were trying to put standards together of really what is the highest standards of biological dentistry, and we want to make that global. So, like you're talking about, there's a standard, not what everybody wants to do on their own, right? And that's the level of quality and standard that it has to be done in every patient. So we're putting that together with a team of 15 doctors. It's globally now.
But maybe someone's listening and says, "Oh, I phoned the office and they said they're certified," but they need to look for telltale signs. So maybe just give me, is it a vacuum? Is it a full coverage? Is it oxygen?
So yeah, obviously you mentioned a few right there. There's special vacuums. The best well-known one is called the IQ Air out of Switzerland. And there's a vacuum. There's a special isolation process inside the mouth so that the debris is not touching your gum tissue whatsoever. Rubber dam is the most well-known way of doing it. Again, there is binders that you need to be switching around before and after procedures. In our office, actually, we've taken, like Shawn said, a little bit step further. There's certain IV therapies that we do during a procedure as well to help with this, your body's capability to still go when it goes through the stress of these toxins. But again, that's not necessarily part of the certification process. Sure. That's just the next level. It's part of the certification process. Again, oxygen, some kind of either a nasal cannula or something that covers your nose, head to toe coverage of the patient and the docs. Very important. Masks. Yeah. For the docs, we don't use a regular surgical mask. There are special masks because surgical masks, it'll go right through it. All the toxicity. So the team is still breathing in all that toxicity. For us, again, it's equally important to protect the patient and the team. Very important. So these are the things that doctors and assistants working on the patient have to be fully draped as well. Their skin's not exposed, their hair not exposed. So those are all factors that are really important. Isolate the area completely. Vacuums, oxygen, coverage of the whole body. Those are all factors.
Brilliant. And now with sort of the technology improving and AI, what is the best substance that people are listening, if they do need a filling, what should they be using? Or what should they ask their dentist to use?
What kind of materials? Porcelain is always a go-to for us, right? That's the hardest. And we have different kind of porcelains that are almost non-breakable now. They're very, very dense.
And most biocompatible.
I mean, porcelain has been biocompatible, that we've known that, but I'm saying the levels of the porcelains of the technology we have now is really strong. So we only use two things. We use either BPA-free composites, right? If they're very, very small restorations, or we use different kind of porcelain materials. Like I said, that we fabricate here on site, because a lot of patients come from out of state or from, like I said, when they fly in, we fabricate everything here and they leave with it. So we don't have to use the outside lab, so it doesn't take 2 or 3 weeks. We fabricate in about an hour and we deliver these.
So what that means is that even some of the standard that was, like, for example, gold restorations, that's been, a standard in dentistry for many years because it lasts so long. You're not prone to, because some of the chemical reactions are very not prone to getting cavities around these gold restorations. Still not. We're not happy with that. We don't use gold because it's not about the aesthetics. Oh, and gold, it doesn't look natural. For us, all metals have no place in the body. Your body reacts to all metals, even the high noble metals like gold, or even the titanium, which is the dental implants. These metal restorations still have an effect on the body as far as inflammation and metal toxicities. And pulsing, Shawn mentioned earlier, EMF, electromagnetic frequencies that acts like an antenna.
And the lost meridians.
And the block in the meridians. All metals block that meridian channel where that tooth is. So then there's a disruption in meridian channels. So for us, we like to use porcelain as far as energy conduction, ideal, biocompatibility, ideal, material right now that we have. So that's the go-to.
Brilliant, brilliant. Now, someone's listening. What are the top 5 things that they need to do to prevent getting cavities?
Oh,
Well, that's a topic that we love to talk about because dentistry always the way they trained us, and again, we're by the way, everything we're talking about, we're guilty of it ourselves. So we did root canals. We thought we were doing it at a high level back in the day. I never did mercury fillings because I just hated the looks of it, so I just took them out. But nutrition is the biggest
fluoride,
and all that.
fluoride. We literally also so most of the time they would say, do fluoride treatments, fluoride in the water. For us, definitely not a good idea. We're not for that.
But nutrition specifically, we talk about it a lot because what happens, dentistry, all they talk about is brushing and flossing. You got to brush and you got to floss. What kind of, fluoridated toothpaste you have to use? Brush and floss, brush and floss. And people come in and they're frustrated. And they're like, I brush and floss all the time. Every time I come in, I have like 6 or 7 cavities, right? So now, in biological dentistry, we realize it's about nutrition, right? It's not just, the brushing and the flossing to kind of stabilize it a little bit in your mouth and your microbiome a little bit is the minor part of it. The major part of it is what kind of diet and nutrition you have. Because if you're low on vitamin D, magnesium, zinc, and K2, you're not going to be pulling calcium into the teeth, right? No one talks about that. So the studies have shown if you're not pulling calcium properly into the teeth, you're going to get a lot of cavities.
Okay.
Right.
Low vitamin D levels is a big thing. Of course, again, nutrition overall. This is something that we've known actually for a long time. The work of Weston A. Price, if you're familiar with him, he was a dentist in the 30s that did a lot of research on this. Great book. I recommend everyone to look him up. He went to indigenous villages around the world that were not exposed to the Western diet. And he saw people with full arches, no cavities, poor hygiene, but they didn't brush on a daily basis. They didn't have Crest toothpaste and mouthwash, all these products that actually are disrupting the oral microflora, which is an important aspect of this as well, more than anything else. So instead, they had great diets, natural diets, high in protein, high in good fats, high in getting nutrition from all these sources that were filling up their minerals and micronutrients like we talked about. And then they had proper jaw development at the same time, not needing to take their wisdom teeth out, not having crowded teeth, everything functioning better because of what? Nutrition. Yeah. The basics. What makes you healthy systemically is what makes you healthy
absolutely orally. Okay, so nutrition's number one. Even a lot of these people that Weston Price went to, they would be being breastfed till the age of 4 and 5, and I'm sure that must have helped their palates as well. The reduction of breastfeeding, so important for that palate to develop, so important. The best food you can find is breast milk. So there's a lot of factors, and my audience is quite well versed in nutrition. So I think we'll put it at that and say, obviously, your microbiome, whether it's your oral, whether it's your nasal microbiome, whether it's your skin microbiome, wherever that microbiome and that good flora and that bacteria is crucially important. Let's talk just another for cavities, because this is something that has plagued me, having not missed a single day's work in 27 years, never taken a sick note, no Western medicine in 27 years. I still battle with my biological dentist. I get some tartar right at the bottom of these 2 front teeth here that develop. And I'm convinced that because I need a bite plate, and I want to talk about bruxing, clenching, and bracing, because these things are very, very important, related possibly to the vagus nerve, and that I wear the bite plate in, and I don't think, and I do breathe through my nose because that's been crucially important. I think there's a little bit of air that comes through And if people are mouth breathers, maybe give us your experience on what happens with regards to cavities and mouth breathing.
So, should we address the mouth breathing or the grinding? You mentioned grinding as well.
Well, I think the
So,
grinding second. The reason I'm wearing a bite plate is that I've seen more bruxers and grinders more and more. I think there's a tiny gap that a little bit of air comes in. I think that's why the tartar comes through to the front because, we can talk about my protocol, but I do think there's something that's happening if you're a mouth breather with regards to cavities.
absolutely.
Well, it's a good point that you brought up. So Ben and I also were diplomats in sleep apnea. Okay. So we work with a lot of MDs that were treating sleep apnea for them when patients are diagnosed by the medical doctors. So what happens is that when you're mouth breathing, right, you're not nasal breathing. It's a major issue because you're not getting nitric oxide production. So you have to be nasal breathing, as you know, right? So, and a lot of patients that have sleep apnea that is undiagnosed, first of all, they're grinding. So 87% of the patients that grind, they usually have some sort of sleep apnea issue, okay? And it's undiagnosed. So what happens is dentists see the grinding on the teeth, they see the byproduct of it. They're like, oh, you're grinding, we have to put you in a night guard or some kind of bite guard, right? And unfortunately, that actually makes the sleep apnea worse, okay? So it's very critical when we have patients, we want to find out why they're grinding, right? And if it is, we send them for a sleep study. We tell the medical doctor they should go and get a sleep study done first. And then we find out if they first have sleep apnea or not, or why the grinding is happening. And a lot of patients, if they're not breathing well from their nostrils, we send them to an ENT to open it up because the nitric oxide production is huge for, as you know, for the whole body. Nitric oxide is so critical. So, the grinding issue is very important on where it's coming from. We have to distinguish, like I said, that's a big number. 87% have sleep apnea, which is undiagnosed. We did our residency at UCLA in sleep apnea. So these are the things that we studied, and we realized that it's such a critical airway, is such a critical point of your whole body. And if you're not getting it, and like I said, no one really talks about it. I don't know what your thoughts are on that.
To add about what you were mentioning about mouth breathing, a couple more things to talk about regarding that. One, when you're mouth breathing, it is drying out your mouth and your gums and your teeth of some of that saliva, the important saliva, that good microbiome that's in that flora is actually protecting your teeth. One of the things that we have to realize is that the saliva is a protection for these teeth. Now, when there's lack of saliva due to mouth breathing, now the gums, a lot of times you see more inflammation. You also get more cavities. So when you reduce saliva in general, like people that do cancer treatment, their salivary index changes, that they have less saliva. They're more prone to cavities. Now, so one of the things that we should say is, yes, Shawn said, we want if someone's mouth breathing, we need to address it. Why? Now, is there inflammation in their nasal airway? Is there obstruction in their nasal airway? A lot of times, again, there's probably some dietary influence. Inflammation in the body, again, pretty consistently is related to a hyper-inflammatory diet, which is the Western diet. Hyper-inflammatory, causing many causes of the airway issues for adults and for kids, enlarged adenoids, enlarged tonsils. For kids, that are also causes mouth breathing for kids. Now, when this happens, you are now losing out on nitric oxide, you're causing problems in sleep quality, like mentioned, but it's all connected. And ultimately, yes, there's things like mouth taping. I like to mouth tape. I actually do it for my kids as well. But you have to be careful. Mouth taping is not for everyone. If you have nasal obstruction at all, or sleep apnea related nasal obstruction, mouth taping will make it worse. So you have to make sure it's the right thing to do for you and address the inflammation that's maybe obstructing your airway and nasal airway. And then support, and it's almost like a reminder to close your mouth. You don't want to force the situation. with mouth taking. So that's something I wanted to address too.
Brilliant. So if you're listening out there, first, nutrition. Second, make sure that you're a nasal breather. And just if you're listening out there, we've been using hydrogen peroxide nebulization since COVID. It's been a game changer for helping people become nasal breathers. Really, really helped that area. And hydrogen peroxide using, one of these water dispensers in the mouth, one of these water sprays. It's been critical. And I want to hear what both the Javid brothers have to say about using hydrogen peroxide in the mouth. But I do want to make a point on the third thing that I think is crucially important, and cavities in the mouth and the position of the mandible and what we call the vertical dimension, the space between the condyle and the fossa, is looking at the cervical spine, having done a lot of regenerative techniques at C1, C2, C3, getting that position right, getting that craniovertebral angle correctly. I think one of the biggest reasons that I'm clenching, and I don't have any wear facets, guys, on my teeth, but I do clenching, is just the strength and the position and the structure of the neck. So maybe speak into that if you've got any experience with regards to those that are bruxing and that are clenching. And if you're listening out there, grinding is very different to clenching. A lot of people just clench, their teeth look good, but if you just look at the tongue, if you look at the inside of the cheeks, you see these marks. So maybe speak into that, which I think is a very, very important part of oral health.
Well, again, we want to look at root cause of problems. When you see a symptom like clenching or grinding, like you said, two different things. What is the root cause? Why is it happening in the first place? One of the things Shawn mentioned as a source or potential cause is airway obstruction, obstructive sleep apnea. Another potential source is bite interferences. If there's a bite interference, a lot of times that also is not only showing up as a symptom and grinding, but bite interference is one a lot of times people don't realize are also a block in the meridians as well. So when you have a bite interference, there's a cascading effect that affects a lot of things. So a lot of times people think like, oh, I want to have a straight teeth for cosmetic reasons, but you want to have a balanced bite to have a balanced physical system as well. It's all connected. You said cervical spine. Now we know that a lot of times airway issues or grinding and all this so much connected not only to this situation here, but again, holistically, we got to look at the whole body, the cervical spine and the whole body. If there's misalignment somewhere down the line, it can show up here, or there's misalignment here, can show up everywhere else. So the next chapter of airway is a collaboration with chiropractors, physical therapists, to get proper alignment throughout the whole body, including the jaw, the teeth, the joints, and the cervical spine, and throughout the spine. So all that is a factor. Again, we got to look at anything that happens, we got to look at the whole body. But if we're zooming into one spot, we're missing the boat. So you have to address the whole body, from nutrition, like we talked about, from alignment, whether it's the teeth or the cervical or any other aspect of the spine or even hips or everything. We know that has an effect on how you hold your jaw. So this is all the factors. So the next chapter of dentistry and is not teeth necessarily, is the whole body.
Total body health. That's
Total body health. It's just what we believe biological dentistry.
where you're putting it.
Yeah. Why biological dentistry is not just about teeth, it's about whole body.
Well, if your head was not connected to your body, then it would be different. but it is. So that's why it's total body health.
You guys are health. You guys are health legends.
That's why we call it Smilebody, mouth-body connection.
Yeah. And holistic dental and medical well-being, because they're so interconnected. So that's crucial. Do you guys use heart rate variability and looking at sort of objective stress scores to have a look at something like grinding and clenching? Because I think, as you know, if you're grinding and clenching, then what happens to your teeth surfaces and how does that sort of give you a proclivity to getting a filling?
Yeah, I mean, everything has to be balanced. We actually have scanners at Smilebody that we scan the whole mouth, and then we have a tool that it shows the pressure points on a digital way. Yeah. So this is
what's this called?
incredible. Yeah, so like if you were here right now, we do it on you. We could see exactly.
Called the iTero.
Yeah, so we can see exactly. Well, maybe when you fly into Smilebody, we're going to do it for you, right?
Yeah, sure.
We'll know exactly where your pressure points are. It's not about like how it is in dentistry. They're trying to put some papers and trying to figure it out, and all, So we have a special scanner that we can kind of see digitally exactly where the pressure points are based on colors, and where the highest points are, where's the lowest point, and we talk about it to patients. So there's no guessing anymore where your bite's supposed to be. So it's an exact science now. At least for us.
If you look, this was for Alvaro. This was a big thing. We have one of our friends. He's a super athlete, and he goes around the whole world. He's done 7 marathons in 7 days on 7 continents. Let me tell you, this guy. He's a beast. Okay, and he called me and he said, I've been having this weird jaw pain every time I do a marathon, I do a sporting event. And everything's healthy. Everyone says it's healthy, and no one can find the reason why. And this is, if you look at our social media, there's videos on this topic and on him. He came in, we did this assessment that Shawn's talking about. We found that he was biting unevenly. There was a bite interference. Through just a few minutes of balancing his bite,
Yeah, it was just.
there was immediate relief.
He said it right away. He goes, "Oh my God, man, I feel so much better right now." All of a sudden.
So this interference in his bite was causing actually performance issues. It was causing issues in this. There was dysfunction in many levels, and just balancing of the bite. Again, this is really important to have balance.
So what's the machine called, Ben and Shawn? Because this is important.
It's an iTero. It's called an iTero scan.
iTero scan. And is this used by biological dentists, or is this something that unique to Smilebody?
No, a lot of biological dentists. Technology is something. It's what you want to have in your office. I know we have it here. We thought it was very important to have it. I'm sure other dentists have it. But this is something that is very critical for us to check the bite. Right? Because the way dentists normally do it, I'm sure that's the way they did it on you. They keep putting their paper back there, right? And they keep telling you to bite on it. And it's just the person's perspective of what they think is.
Yeah, of course. It's rudimentary. There's no technology. That's why I'm interested, because I never heard this. And, we must have done at least 7, 8 podcasts with biological dentists. So you see, looking at the tech being so important. And then when you balance it, do you build up a little bit, or do you take away? How do you balance that bite?
Well, it depends on what it is. Like for what Albert, the gentleman he's talking about, we actually went back there and polished some of the high points. And to be honest with you, just a minor adjustment that we did based on the computers and actually, yeah, we just a couple of small adjustments right away. He said, "Oh my God, I feel like my bite feels really good right now." So we didn't have to guess, because the computer told us exactly where the highest pressure points are. And so now it's very, very simple for us to figure it out. Before, like I said, 30 years of practice, I used to do it the way you're talking about.
Yeah.
I wanted to address one more thing when it comes to clinching and grinding that a lot of times is overlooked, and a potential reason why people clinch and grind. And again, as an overlooked reason, as an overlooked root cause, and that is parasites. This is also parasites in mainstream medicine is something else that's also overlooked. And its parasites are not only show up for sometimes as in clinching and grinding, but also a block in the meridians. We went and studied with doctors called Simon Yu out of St. Louis here in the United States. He's world renowned in addressing many chronic health issues by measuring the blockages in the meridians with a machine called an EAB device. And this EAB device, if you've been familiar with it, can measure blocks in the meridians. And the way he addresses those blocks is mainly 2 ways. One is getting rid of the parasites, deworming, which he believes everyone should be doing at least twice a year, and everyone should be doing, and looking for interferences in their mouth from sources of infected teeth, like the dead organs of root canals, something else called cavitations, and metals. So for him, that is the way he gets people healthy, and people fly him from around the world for his treatments.
Wow.
Yeah, there's four top things that he talks about that he will not treat you if you have these four, root canals, cavitations, heavy metals, and parasites. Has to be addressed.
Wow. Sure, sounds
Yeah.
incredible. That's we'll put those links in the show notes. Tell us about oral hygiene. You had a good reel on some people are flossing incorrectly, but the use of possible, brushing, electric toothbrush, using one of these water like spritzers with. I use a bit of hydrogen peroxide. I've used ozone. I've injected ozone in the mouth. I trained with Frank Schellenberger in the States. Incredible process, using ozone. We've got it in the clinic over here. Give us your protocol on just, using these different, what toothpaste and what your oral sort of program is.
For what I tell my patients when I see them, we want to keep it very simple and basic, right? So I tell them to use a round electric brush and do not touch the gums, because we see a lot of gum recession that happens all the time. Because patients, for some reason, they think that they're supposed to be brushing their gums, right? And that causes a lot of gum recession with manual brushing. So we unfortunately have to send them to our gum specialist to do gum grafting. So it causes a lot of issues. So what I tell them is you want to use a round brush and just basically clean the enamel. Do not touch the gums at all. And for the gums, what we tell them to use, they can use a water pick with a little bit of hydrogen peroxide in there, like you were mentioning. So hydrogen peroxide is fantastic. But in our clinic, we use ozone for everything. So everything, all our chairs, the bottles are ozonated, so they're getting ozone cleaning. For your listeners, I don't know if they know, ozone is an oxygen molecule that we charge it to become O3. And O3 is an amazing natural disinfection for bacteria, viruses, and mold and all that. So that's what we use in the clinic, right? But we keep it very simple. Toothpaste, really non-fluoridated. We don't want fluorides, right? And I don't really talk about a specific one. The ones that we use here in the clinic, none of them taste really good, right? Which we sell for the taste, but it's just a matter of trying to keep it as clean as possible.
The key thing is, I would add to that is, first of all, zooming out for a second. Again, number one is an anti-inflammatory diet, good nutrition, minerals and micronutrients. If you have a good balance with all that, with your good microflora, you're going to have less issues. Our colleague out of Germany, he is not a fan of flossing, biological dentist, because he says if you're healthy enough, you don't even need to floss. If you're healthy enough, the next chapter of dentistry is get your patients so healthy that they don't have to come in for cleanings. Their mouth is healthy, like those endogenous people that we were talking about, and when we talked about Weston A. Price. Now, but either way, at this point, we want to make sure that patients are utilizing natural techniques like the Ayurvedic technique of coconut oil pulling, for example, that helps clean out a lot of the toxins there that might gather up in between the gums and the teeth. We're a fan of that. When it comes to flossing, I want to make sure we don't use some of these flosses that have so much microplastics in them. And in like some of the top brands that you might know of have a lot of these forever chemicals and microplastics in them that we're constantly forcing between our teeth and ingesting. So we want to use bamboo fiber, silk fibers. These are the things that we want to utilize. And then as far as
Tongue scrapers
is a great tool as well. Copper tongue scrapers. Well, that is not just hygiene.
Yeah.
Tongue scrapers are great for oral hygiene for sure. But another factor is that they stimulate that good bacteria that causes nitric oxide release as well. So that is also beneficial there. And then with the toothpaste, there is some of the avoiding fluoride, avoiding some of the things, something called SLS, a lot of these that are foaming agents. These things are foundational. There is things like xylitol and hydroxyapatite. I'm a fan of the micro hydroxyapatite, not necessarily nano. I'm not a huge fan of the nano hydroxyapatite because that is synthetic and it actually passes the blood-brain barrier.
Sure.
So I'm not a huge fan of that. But overall, clean products as much as possible, and less is more.
Sure. Incredible. So if we summarize again, cavities, it's nutrition, which is fundamentally important. I think alignment is what you've said as well. Then good oral hygiene. And if I don't know if it's Dominic Nishvitz, he's been on the podcast twice talking about it.
Yeah,
I've debated this thing of flossing. So maybe you'll use a water pick or water spritzer with a bit of hydrogen peroxide. And then what else in terms of, watching your clenching and grinding, and that's important, making sure your nasal breathing. Anything else with regards to cavities?
Cavities, it's did you mention oral microflora? Because that is
Yeah. We mentioned obviously
Yeah.
there. I don't know if you've got something. Would you use a mouthwash to help that? Obviously, using traditional mouthwashes are terrible and they cause a lot of issues. A herbal product or any essential oils that you'd recommend?
I mean, what we just talked about right now, like Ben was talking about, less is more. We don't want to, that what we talked about was a lot right now for a balanced microbiome. Okay. So we don't want to overkill because this regimen, first of all, the nutrition that, like we talked about, what we talked about, pulling calcium, that's like 80% of it right there. So everything else that we talked about,
micronutrients.
yeah, it's about 20% that we talked about.
Gotcha.
So that 20%, we covered a lot of in that, and 20%, like we just said, right? Just that regimen itself, we see so much balance in the microbiome and the oral flora that it's really, you don't need more than that. So it's not gonna, if you do what we just talked about right now, you got to get a lot less cavities.
You can keep looking for more products and more of this and more of that. It's kind of like the biohacker approach. You keep looking for something else. But again, we believe less is more, and get to the basics, and the very basics.
But I think we've forgotten one, guys, a very, very important one. I don't know what you think about this, but I think this is fundamentally important, is to kiss as many people as you can so that you can share bacteria. Now, give us your perspective on that.
Yeah. If you do that, for sure, that'd be very good. You'll be more immune, right?
I've been married 25 years to my wife. I said, listen, love, we got to kiss. We got to share bacteria now. We got to kiss like we did when we were courting 25 years ago. But that's important, physical touch and kissing. What do you guys say?
Yeah, I mean, again, having a diverse microflora, it's something interesting on that topic. There's been proven that even the owners and their pets will share a lot of that oral, a lot of the same microflora. But again, it's all these things help. And again, for us, Dome is a good friend of ours. You mentioned Dominic. And, we all will agree is that the foundation is just do the basics. Don't try to do too much. Just do the basics of foundation as far as nutrition, and the microbiome and micronutrients will come into balance there. And when you have that balance, you don't have to do too much. Yeah. You're overthinking, to keep looking for more products. And that's why we shy away from pushing, too much.
Yeah. Got you. I know we've got a few minutes, just a short summary why and, how bad root canals are. People are listening and then what they can do. So they've said, I've had a root canal. Great. Now what can I do? It's a source of dead tissue. It's a source of disease. So maybe give the importance of root canal, what they can do.
I think this is a topic that we have to have another podcast for now. I mean, that's a topic of its own, to be honest with you. Right. Yeah, but we'll try to do our best to squeeze it into the last couple of minutes. But so I mean, I took residencies in root canals. Everything that I did in the past we tried to do at a high level. And root canals obviously is a great tool for if someone is in immediate pain and you want to relieve the pain. And the way that dentistry was taught, you put some plastic in the middle of the tooth and you try to preserve the tooth. But what we find is that when we do cone CT scans, there's a lot of these root canals that are infected that are undiagnosed. So patients are walking around with infections in their mouth and they have no idea. So we actually do cone beam CT scans on every single patient that has a root canal in their mouth. So we started doing that about 5-6 years ago, and we found out that so many people have infections, so they have no pain, no discomfort, and these are just microtoxins that are being released into the system, right, all the time, and they have no idea. So it's causing a lot of issue.
Well,
right?
when Shawn says they have infections, one thing I want you to realize whether we take a regular two-dimensional X-ray in dentistry or in biologic dentistry, we like to utilize the cone beam CT scan to find hidden infections that are not visible on regular X-rays.
Mhm.
Now, either way, what you're looking for is the reaction of the bone to the bacteria that's leaking like a leaky faucet from these dead organs that were in a root canal tooth. Unfortunately, you cut off the blood supply, the nerve supply, the lymph supply. These are organs that we've done that to. And any organ body, if you do that to, you are now dealing with the dead organ. And these teeth, when you look at them and when they are removed, they're black, they're brittle, they're decomposing inside the jaw. So when you have a black brittle, like if you have gangrene in your hand, you have a gangrene tooth that's decomposing in your jaw, it's no wonder that it shows up as a leaking in the jawbone on these x-rays. Now, we believe that, these very consistently, and there's a lot of studies out there that they are all leaking something, some inflammatory factors, cytokines, they're leaking, and some toxic material is coming from these dead organs, which only makes sense. Now, so for us, keeping a dead organ for the sake of function is not necessarily the ideal thing to do because there's a better solution than keeping that dead organ. So now we can replace these dead organs.
Well, there was a study that they pulled 30,000 root canals.
So this is part of that documentary, Root Cause.
All of them were leaking mycotoxins, whether you saw it on the cone beam CT scan or not. So if you see it on the CT scan, big infection, that means it's been releasing mycotoxins for a long time and big infection. But even if you don't find a big infection lesion or a cyst or cavitation, it's still releasing mycotoxins.
And this, like I was saying, there's a better solution. We can replace it with a non-metal ceramic implant that does not block the meridian, either because that organ does, and a metal titanium implant blocks the meridian channels. But a clean ceramic implant does not, and it's not leaking any source of toxicity in the body. And a lot of times we can take the tooth out, put the implant in, all in one surgery. And it's something that is, relatively uninvasive considering.
Brilliant. Well summarized. And just the last question, the use of AI and technology in the future with regards to biological dentistry. What are you guys excited about?
Well, there's a lot going on in the world of diagnostics right now.
We have it in our clinic right now.
Yeah.
We introduced AI. I'm a pretty big fan, and obviously Ben is too. So we actually introduced an AI that can diagnose cavities on x-rays now, which is pretty incredible. I always joke around with patients. I tell them that you don't need me anymore, so I don't have to diagnose anything. So when the x-rays are taken, we just push a button, the AI detects all the cavities. And actually much better than our eyes could detect it because,
Wow.
A lot of times it's a smaller decay and you wouldn't find it if you're not really looking careful. So we already introduced that. We're introducing another AI that's going to be helping the front office team, the hygiene team. So,
but as always said, clinically right now, diagnostics is the forefront right now. Obviously, the AI can't come do the surgery or do the restorative work at this point. Maybe in the not so near future, we'll have a robot with AI doing your dentistry. But for now, it's going to be a supportive role as far as diagnostics.
Yeah.
So I don't know if you know, but at Smilebody, I don't know if we talked about this, but here we're always trying to innovate on what we're doing. With we have functional doctors and the ID center and the lab here together. So we're putting everybody, putting them through the healing modality all at the same time in one center. So and we thought AI is a big component of that, because if you don't introduce AI, we're going to fall behind. So we're always looking how to kind of improve things.
Brilliant. Let the audience know exactly, and the viewers know, where they can connect with you and where they can come see you and where your offices are.
Well, obviously, we're located in the LA area physically. That's where Smilebody. It's a 7,000 foot facility, square foot facility here in Los Angeles area. But obviously, you can look us up on our socials at My Smilebody, and also on our website, mysmilebody.com.
Brilliant. Just want to declare favor and blessing on you both. Thank you for your calling, your purpose, your courage to pioneer, to take the technology. Hopefully we become friends, like I've become friends with many of my podcast guests. You come out to South Africa, we host you. We've hosted some podcast guests, and just really a deep thank you for helping people, for transforming people's lives, and being the healers that we need to be out there, all of us together. So thank you so much.
Well, and thank you, Steve, because you're doing your part in getting this information out when you're bringing people like us and others on your show and exposing that information to your listeners and people that are watching right now. So we appreciate what you're doing, and your part. You're making a big impact out there.
Yeah, that's what I was going to say. We really appreciate what you do. So thank you.